I think this year, more than past years, people are starting to actually see the shortfalls in our healthcare system through no one's fault. I mean, this is not the hospital's fault.
Right.
This isn't Blue Water Health problem. It is a funding problem from the Ontario government. And so I certainly do not admire the administration of Blue Water Health having to make some extremely hard decisions. But those hard decisions have left frontline staff doing more with less, and I believe that the people working in healthcare today are doing a Herculean job of trying to provide safe and quality health care. Anyone that has to visit the emergency room and has a well, I don't know exactly how long it should be in Sarnia-Lambton, but it's, I think, usually an 8-hour wait. Some of those wait times are directly correspond to the number of beds that have been cut. Mm-hmm. And if you ask the doctors that work in the emergency, they will tell you the same. It isn't really the patients that are causing the problem. It is, where do you put the patients once, you know, they're admitted?
Yeah, you get a little bit of a logjam there.
I think it's obvious that the provincial government looks at regionalization of healthcare as the way to go. You know, it's cheaper to light and heat one building rather than two.
Right.
But that doesn't fit with the needs of the community. A walk-in clinic will not help the little kid with croup at 2 a.m. Anybody that is, well, from Sarnia-Lambton or into Wallaceburg-Chatham area, nobody wants to be on the winter roads in March if there's you know, a lot of weather out there. So I believe that all our communities need these smaller hospitals. What small hospitals do very, very well, because they've been trained over the years to do this, is to stabilize people and get them where they need to go, whether that's a motor vehicle accident, whether it's a stroke, well, strokes actually do go to larger centers. Let's say heart attacks, let's say surgical cases that need specialists. Small hospitals know how to do that very, very well, and they prepare people, stabilize them, and get them to the helicopter or on the road with an ambulance to the larger centers. Right. And although things are certainly not looking the way they should in the legislature right now, I'm here to tell you that people can be repatriated back to small hospitals to finish their recovery. Alternate level of care beds could be put in small hospitals, and what would that do? It would free up acute care beds in larger centers, whether that be at Blue Water Health or London Health Sciences or Chatham-Kent Health Alliance.
Right, so a win-win all the way around.
I
right?
believe so,
yeah.
And the financial outcome of that is if you help people recover quickly and completely, no readmissions.
Right.